Hi everyone, and welcome to Sjogren Saturday. This is officially our first Sjogren Saturday video. Obviously, as you know, I have other Sjogrens videos, interviews, especially with Beyond Sjogrens. And what I'm going to do is put everything in one playlist. Bear with me, I'm getting it all together. I'm going to just change up all the thumbnails and make them all Sjogren Saturday so that they're all in one playlist. But today is the official Sjogren Saturday, and what an amazing person to start the videos with. So I'd like to introduce Dr. Diana Grinita, who is rheumatologist on call. I think a lot of you who have Sjogrens hopefully have seen her YouTube, but if you haven't, definitely go check her out. I will have all her details below in the description. I couldn't believe it when she said yes when I asked if she would be on the channel and if she could talk with us. What drew me to Dr. Grinita was the fact that she is a rheumatologist, but she looks at her patients as a whole. So of course it's all science-based. You will hear in the video how she is with her patients, how she listens and then does the blood tests, and how she looks at everything holistically. And we'll just get into the interview, and I really hope that you find it informative, and I hope that it gives you encouragement. And if you have any comments at all, please leave them below, and also let me know what kind of videos you would like for Sjogren's Saturdays. I'm sorry that I can't have a video every Saturday. It will probably be about once a month to start off with, but I hope that I will get the momentum going and be able to have Sjogren Saturday more regularly. Without further ado, let's get into the video, and I will see you later. Bye for now. So, Dr. Gernita, thank you so much for coming on our channel and talking with us.
It is a pleasure to be here.
Thank you. I was thinking that the first thing we could talk about, if you don't mind, is to tell our viewers. Most of my viewers do have Sjogrens, but some don't, and some are not sure. So I just wondered if you could explain what Sjogrens is, what it does. Yeah.
Absolutely. Sjogren disease, it's like you said, a very complex disease, but it's also very easily misunderstood, misdiagnosed, mistreated. And starting from that, we have to educate a lot of people about what Sjogren is. We call it for many years Sjogren syndrome because we didn't know that this is a true disease. But just recently, we accepted this idea that is not longer a syndrome, which is a combination of or putting together a lot of signs and symptoms, is basically a well-defined disease.
Yeah.
And it's an autoimmune disease, like many of you know, that will affect primarily the eyes and the mouth. That's how it was described initially by Dr. Henrik Sjogren. And it took many, many years actually to understand that this is a systemic disease, meaning that it's going to affect other organs. And when I say other organs, I do refer to lungs, to the kidneys, to the heart, and to the GI tract and the joints. Many people will have joint problems or muscle problems. And in rheumatology, most of the time we talk about the diseases as primary diseases, which are caused by something that we know, or diseases that come along other autoimmune diseases. And for many years, we have seen that Sjogren comes with other autoimmune diseases. So many patients with rheumatoid arthritis or lupus, they had what we called secondary Sjogren, which was, they had actually symptoms of Sjogren, the dryness of the eyes, the dryness of the mouth, in combination with the other autoimmune disease. But Sjogren itself can stand as a disease, the primary disease.
Yeah.
In my videos, for people that are watching my channel, I talk about the complexity of those symptoms, and I try to educate people about, the fact that there are changing in the voice or the shortness of breath or symptoms of dysautonomia, when they cannot adjust from a sitting position to a standing position, because I want people to understand that this is a systemic disease.
Yeah, yeah. When I was first diagnosed with Sjogren's, I had never heard of it. I had no idea what it was like. And like you say, I was diagnosed first because of the dry eyes and dry mouth, and also ANA blood tests. But apart from those, I didn't know anything else. And before, they used to say to me that I have fibromyalgia because my body was stiff and I had all this pain and all these different symptoms. And I think a lot of it is Sjogren, and it's just has so many different symptoms.
A
Please.
lot of patients
Yeah.
that I have diagnosed along the years with Sjogren,
Mhm.
they were initially told that they have fibromyalgia
Uh-huh.
because they had this combination of symptoms, the fatigue, the brain fog, the cognitive issues, and the widespread pain, which are all part of Sjogren. So what I tell patients before I jump into conclusions is let's make sure that you have the right diagnosis before we treat you.
What I really, really like about you is I've been following, I've subscribed, liked everything, your YouTube video and your Instagram as well. And I will put details of everything below in the description for everyone. But what really drew me to you was that um, you're not like other rheumatologists that I see, because you really do look at a person like wholly. So, and and tell me a bit about that. How are you able to do that? Because I just thought maybe a rheumatologist is just, deals with, well, doesn't deal with the holistic anyway.
Now that you ask me how did I change my approach,
Mm.
that was not in 1 year or 1 month or one day. It took years for me to transition to a more holistic and more, I would say, integrative approach.
Yeah.
I like this term of integrating other things into the care of a patient. I was a science girl from, my very young age. I did a PhD in immunology, I did medical school, and I took the path of, recognizing symptoms, diagnosing people, and treating primarily with medication.
Yes.
This was not all my fault. This is how the system is designed
Yeah.
to teach you to become a doctor. But then when I started to practice and I started to interact with patients, I thought about what they were saying to me. They were telling me that they are doing certain things in their life
Mhm.
that they find helpful.
Okay.
And that was fascinating to me. And I started to research if truly there is evidence, scientific evidence, that certain supplements will help them. And I did find evidence for that. And then I found evidence for sleep
That's good.
or exercise or mindfulness, and obviously about diet. Certain
Yeah.
things that patients will eat. They were telling me, I was to a party and I ate this or I drink this, and the next day I was in terrible pain.
Mhm.
And initially I said, how could that be possible? What is the relationship between a party and what they ate there and how they feel today? And I started to dig the internet. We have a very reliable website. It's called PubMed, where
What
you
is it
can
called?
find all the literature, all the scientific literature in the world is dumped in there. PubMed. It's a library, it's a medical library
Yeah.
where everybody in this world, if they publish articles,
Yeah.
they will be collected there. So I started to look for articles and I started to look who are the people who wrote the articles, if
Yeah.
this is a respectable journal, how
Yeah.
many people were in the study. So I had that background, the
Yeah.
scientific background, the researcher background. So I knew how can I sort through things to
Because
find
that would
out
take a
valuable
long
information.
time.
It
Because
took
that takes a
years.
lot. Yeah. Yeah. It would
Yes.
take years.
So every time when I was finding something interesting from a patient, I was researching that. And if I found evidence, I started to incorporate that into my practice. And I have seen huge improvement just by changing diet, taking a supplement, educating people about taking rest, managing stress. And myself, I had to educate myself about the scientific evidence of nutrition, the scientific evidence of supplements. And I hate to repeat myself when I say scientific evidence, but I think it's important for people to understand that science can be our ally and is not our enemy. And the more evidence we have from multiple people, the better it is, the safer it is. Because that's also about safety here. You don't want to take a supplement that could be dangerous for you. You don't want to take something, a powder that your neighbor takes, because that could actually cause you more harm than benefit. So that's how I discover the integrative part of medicine.
So when you say about how something could be dangerous if your neighbor gives you something, so obviously you look at everybody individual bodies, and everybody works differently, everybody's got different issues. So you really can't say, oh, everybody take, well, I mean, I guess there's some things maybe, but you can't really say everybody take D-ribose, everybody take magnesium. I think
Absolutely.
you definitely have to look at every individual separately.
My approach is very personalized. So I spend a lot of time with my patients because I want to understand not only the disease, how the disease works for them. Every patient is unique. The presentation of every patient is different. And then their needs are different, their beliefs are different, and the way that they react to medication, it's different. So I have to take in consideration all of that when I make a plan for a patient. And the plan can change in time, but the plan is adjusted based on their needs. I never say this is the way or this is the highway, because we know, I've known and I've learned in many years that my patients will have specific requirements, and you just have to work with each of them to meet wherever they want to go. Sometimes patients, they want to have less fatigue. That's their goal. Or sometimes they want to have less pain. They're not so bothered by fatigue, but they want to have less pain. So you work with what the patient wants, what are the goals of the patient, and then you optimize as much as you can the treatment for them.
Yeah, that makes a lot of sense. So I was going to ask you to could also explain how you work in your practice, about how people can come to you and how that works. But also for people who maybe can't come to you, who um, their rheumatologist may be failing them, or maybe they don't know what questions to ask or how to be, because it takes time. Because I think a lot of us just listen to our doctors and we just accept things, and sometimes we don't ask the right questions. Or I mean, there have been times where I haven't gone to my rheumatologist for a couple of years actually, because I see a functional medicine practitioner and nutritionist. But the last one of the last times that I went to my rheumatologist, they didn't want to do any tests. They didn't really listen to me. They just basically told me, we'll see you in a year, you're okay, or whatever. What advice would you give to people who are suffering with Sjogren's, um, that how they can get the best out of their rheumatologist?
Absolutely. I think this relationship that we build between physicians or medical providers and patients, it has to be deeper. It doesn't have to stop to the questions, how do you feel today? What are your symptoms? Here is the medication, move on to the next patient. I think that we are partners into this, and that's what I tell my patients. I'm here to guide you. I'm here to listen to you, and we will work with the best tools that I have, and you will also work on your side, because it doesn't matter what I say if the patient doesn't believe in what I say. And it doesn't matter, for the patient also, it's important to come up and to advocate for them. I tell my patients all the time that they should tell me what are the things that they want to be solved. Like we said, every patient of mine, they have a diary of their symptoms, a diary of their goals, and we try to stick to that. We try to understand what are their goals and where we should focus our work. If people with Sjogren or autoimmune diseases do not have a diary, I strongly encourage them to do so for multiple reasons. A diary can be where you put your symptoms, you track your symptoms, you see if you improve or you don't, because most of us, we forget about what happened 2 months ago, 4 months ago, 6 months ago. So if you have a bad day today, you can look back and see, do I have every day or do I have it, how was it 3 months ago? With this treatment, do I see improvement? Or just this is just a bad day, but the rest of the days are good. So I encourage people to write down their symptoms, track their symptoms. The other thing that I want them to write down is 2 or 3 things that they want to focus on. So do they want to improve their fatigue? Do they want to improve their pain? Do they want to, improve their stress levels?
Yeah.
Things like that,
Brain
things
fog. That's one of them as well.
correct.
Yeah.
The brain fog. Okay. So you have to kind of put your focus on what are those important issues and share them with your rheumatologist. Tell them, I do want to feel better because I feel very fatigued. This is impacting my life.
Yeah.
Or I do want to have less pain. This is the main problem that I have today.
Yeah.
By sharing your goals with them,
Yeah.
hopefully they will listen
Yeah.
and they will try to work with you in that direction.
I like that. So you come in already prepared. You've already, because I think it is very important to have proof of something, not just speak it,
Absolutely.
but also have it on paper and say, I love that idea and say, look, this is the last 3 months. This is my
Correct.
fatigue level or whatever, pain level, all these things. And my quality of life is bad, or I'm suffering because of the pain or because of the fatigue, and maybe even give examples of,
Absolutely.
yeah,
Like, for example, in 1 week, if you have every week
yeah,
flare-ups of Sjogren,
yeah,
it means that your disease is not controlled,
yeah.
because not always we see the flare-ups of autoimmune diseases in the lab work. So the fact that the markers of inflammation are not high
Oh,
or the NA titer didn't change,
yeah,
that doesn't reflect how you feel.
yeah.
Not always. Sometimes we see markers of inflammation high,
Mm.
but not always whatever we see in the blood work matches the symptoms.
Okay, so sometimes if we're physically feeling it, but the blood tests say otherwise, it still could mean that Sjogren's is being active.
Absolutely.
Oh, interesting. Okay, so it's very important then to keep an eye on you for us to write our
Yes,
symptoms
you
down.
have to kind of write down, let's say, the level of your pain, the
Yeah,
level of your fatigue, make a scale from 1 to 10
yeah,
or 1 to 5, whatever it's convenient for you.
yeah,
And whatever it's 5 for you,
yeah,
for your neighbor or for another patient who's Sjogren,
yeah,
might be actually 10.
yeah.
Okay. So how you look at your symptoms is very different, or how you perceive your pain, your fatigue is very different from others.
That's true. That's very
So
true.
that's why this needs to be personalized to your needs and to your body.
Oh, I love that. So I know that there's certain tests that people can take to find out if they have Sjogren's. I myself took tests for about, I don't know how many years until it became apparent that I had positive ANA and other things that showed Sjogren's plus symptoms. But for years, even though they were testing, we couldn't see anything. So could you explain what would be the best tests for people to take with Sjogren's and what these tests mean?
Absolutely. When you have the suspicion of an autoimmune disease, the first test that it's usually done is the ANA, or anti-nuclear antibody. This is kind of a test that will put you into that pool of patients that might have an autoimmune disease. But as I say again and again, a test itself does not make the diagnosis, but it's a beginning. However, patients with Sjogren can have a negative ANA test. And that's the tricky part. So if you have the symptoms, the dryness of the eyes, the dryness of the mouth, the constant thirst, the difficulties to swallow food, a lot of the dental cavities, a lot of swelling of the parotid glands, and then you start having joint pain, it must be something more than just dryness. And then if you have an ANA positive, or if you still have the suspicion of Sjogren, we usually run the test called SSA and SSB antibodies. These are famous for Sjogren people, but the same type of antibodies can be seen in lupus patients or can be seen in rheumatoid arthritis patients. And I've seen it also in patients that had COVID vaccine or COVID infection. And I've also seen it in people that have other autoimmune diseases like primary biliary cirrhosis or hypothyroidism because of autoimmune thyroiditis. So just the fact that you have the SSA and SSB positive, again, does not qualify you for a diagnosis of Sjogren. I actually had a patient yesterday with positive SSA and positive SSB antibodies that had absolutely no signs of active Sjogren at this point. Does she have Sjogren? I don't know. But she does not have any symptoms of Sjogren, but she has the positive antibodies. So that's what I say to people. It's important to have that comprehensive approach, comprehensive look, because not always the test will equal a diagnosis. But if you have the symptoms and have a positive NA, a positive SSA and SSB, then most likely you might have Sjogren, right? Now, there are other tests that we do. We look at the cell counts, we look at the kidneys, we look at the liver, we look at complements level, we look at serum electrophoresis. We try to look at other blood tests to understand the degree of involvement of this disease. And then we have tests that are specific for the eyes, like the Schirmer test, for the salivary glands, like a biopsy of the salivary glands, that can be diagnostic, or we can have imaging tests. We look at how much flow is coming out from the salivary glands, or we can look at the lungs if we suspect that the Sjogren affected the lungs. So we use other tests to understand how is this disease impacting the body. And what is important for people to know is that if you have a diagnosis of Sjogren, it's also important to follow up on these tests. Things can change, and Sjogren might not affect any of your cell counts or liver or kidneys at this point, but maybe in 6 months you might have something that is coming up. So it's important to follow up with a physician or with another medical provider that knows about Sjogren and they know how to monitor for things, because not everybody understands the Sjogren. They might understand, the medical part, but they don't understand the consequences of a disease like Sjogren.
Yeah, I think that's why I was so disappointed with my rheumatologist, and I actually asked for a different one, and that one didn't go very well either. But the reason why I was disappointed in my first one is because I went there after quite a while, and also I was on hydroxychloroquine at the time, and
Yes.
I went there and I said, could we have some blood tests, check my liver, check my kidneys, and they said there's no point, and they wouldn't check anything. And as soon as it said that, I thought, right, this is not the person for me. I will move on to a different rheumatologist. And I'm so glad that you said that you would imagine that it's important to keep an eye on these things so that you can be in control of them and help us sooner rather than later.
In my practice, I start with evaluations every 3 months. And then if everything is normal, everything is stable, then I still follow up with blood work every 6 months.
Okay, wow. Okay. Well, that's fantastic. That's really good. I am really curious. So with your patient yesterday who had the SSS but didn't have any symptoms, what would you do with that? Would you just wait and just keep maybe test
I
every.
will follow her. Yes, I educated her very much about what Sjogren means. She actually came to me with the diagnosis of Sjogren, and I sat down with her. I listened to her story first,
Yeah.
and then I look at the blood work. And this is my approach. I don't want to be biased by things that I see in the medical records. So for me, the
Yeah.
most important thing is what I hear from the patient, because many times we as physicians that we are very, very focused and very, very trained into certain things, we tend to pick up what is important for us. We
Yes.
pick up
Yeah.
and we're going to
Okay.
write that down
Yeah.
because that feeds our story,
Yeah.
but it doesn't feed the story of the patient. My approach is different. I listen to the patients first. I try to understand where are they coming from, what was it done for them, how did they evolve over years, and then I look at the blood work because I want to match my hypothesis with what's in there. And my hypothesis did not come up with any diagnosis of Sjogren. And I said to her, I might disappoint you today, but I don't think that's the case. You don't have Sjogren. Not today. I cannot predict what's going to happen in 5 years from now. I cannot predict if you're going to have it or not. But I can tell you that today you do have some tests. And she also had a year ago, something like that. She had a bad infection with COVID. And
Oh,
I have seen how COVID infections can trigger these types of antibodies.
I see.
Again, she might have it at some point, she might turn around and she might develop it. But as of today,
Yes.
I do not think this lady had Sjogren.
Oh, that's good. That's good for her. It's interesting that you say about COVID as well, because my daughter, she has long COVID, and we have very similar
Mhm.
symptoms. But I noticed that what works for me doesn't work for her, and vice versa, because it's different.
Yeah.
But there are some similarities. Yeah. I wonder if she would have the SS stuff if she had her blood test. Interesting. Very fascinating. I did notice on your Instagram, which I had no idea, when you were saying that people could have other things. It doesn't have to be. Well, I think it was with the ANA that it doesn't have to be.
Yeah.
Doesn't have to be sugar.
The ANA test, it's one of the reasons that a lot of people will come to see me. A positive ANA test, it could be very puzzling. If you search the internet for after you get a test and the test is positive, then the first thing that it will come up will be lupus,
Yeah.
are associated with lupus, and that will create a lot of stress in someone's mind. So what I tell people, and I have that in my channel, I have a couple of videos about positive ANAs. I try to explain to them that a positive ANA is not a diagnosis of lupus, that's number one. And it's like, I found this, interesting that it's like when you go for the TSA in the airport, you go through that machine that
Yeah.
will detect some metal, it's gonna
Yeah.
beep, 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 but doesn't always gonna tell that that person it's a dangerous person. It's the same with the ANA. I think that it's gonna beep that there is something going on, but not necessarily will mean that that's an autoimmune disease. NA positive can actually be seen in people with infections, a lot of infections, even people with cancers,
Yeah.
from people with certain medications, they can develop a positive NA, and even normal people. The older we get, the higher the chances for us to develop a positive NA.
So interesting.
So
Okay.
that's something that people don't talk about.
No.
But in life, we encounter a lot of things that are foreign to our body. And our immune system will try to fight that, will try to react to that. And in that fight, it's going to develop these positive ANAs, positive antibodies.
Yeah.
So that's why certain people without any symptoms will have a positive ANA.
Yeah, that's very interesting. It's so important because when you're first being diagnosed because of just something like that, they say, oh, it's possible that you have lupus or you have Sjogren's, and it may not be the case. So that's really good for people to know. Do you have any advice for people with Sjogren's, and maybe something positive for us to hold on to as well, perhaps?
Totally. I think that people with Sjogren have to know that this is not the end of the world. I know that sometimes it's rough when they hear that, but I want you to understand that patients with Sjogren have options. And if you find the right people, and if you take the right approach, you will get better. I tell all my patients about that. And in the beginning, they don't believe me. I
Yeah.
see that. I see that in their eyes. But with small steps, you can conquer the world. And that's what we do in my clinic. We tell patients that yes, medications are helpful. I'm never going to say medications are not. I'm actually looking to see new medications coming in on the market that will be specific for Sjogren. And there are very good results in the clinical trials that I have seen running right now. I actually have a friend who has a clinic where she is running a clinical trial for Sjogren, so I can send some of the patients there.
It's not dialpap by any chance,
Yes, the
because
DAS. Yeah,
I
we call it DAS. Yeah.
because
I
I've
actually
been
have a friend, another physician, Dr. Kara Wada. You probably heard about her. She was in a clinical trial and she feel better. She shared that. She shared that she feels better after
I'm
the clinical trial.
I'm supposed to start it
Okay,
end of this
okay.
month. I'm supposed
I
to
hope
start.
that when you start into these clinical trials, you start with hope because
Yeah.
the placebo effect, it's
Yes.
also important.
Yes.
20 to 30% of people, they get the placebo benefit.
Yes. Yeah.
And I don't think that's bad because
Yeah.
in our body, it's very well connected with our mind. So all
I
these
agree.
drugs coming on the market, and there are 4 of them that I know about, they promise a lot. If not all of them will be great,
Yeah.
maybe a few of them will
Yeah.
help patients with Sjogren because we need that.
Yeah.
And focus on what you do day by day. I tell people in my clinic that food is so important. What you eat is what you are. And I have a very, very personalized approach when it comes to food. I encourage people to stay away from any processed food. I encourage them to approach an anti-inflammatory diet. And I talk to them a lot about the benefits of the Mediterranean diet, which
Yeah.
everybody knows about. And then I do incorporate certain supplements into my plan, but not all of them will apply to everyone.
Yeah.
And I talk about omega-3s, vitamin D, turmeric, probiotics. Those are helpful. But again, food is the base of what you do every day.
Yes.
And then on that, you can add the supplements, you can add some exercises that you can do. You don't have to run the marathon,
Yeah.
you don't have to do very strenuous exercise, but just moving.
So you think
Because
movement is
moving
very important?
Moving, I call it motion is lotion.
Okay.
Moving, stretching will help your muscle, will help your joints, will help you prevent that horrible stiffness,
Yeah.
and will help with your fatigue and mental health. It's a lot of evidence that will help with all of that.
Yeah.
And then I also teach patients, and I encourage your audience to find ways to decrease the stress. We all have stress in our life. We cannot eliminate stress from our life, but the way that we look at stressors, the way that we approach it, is very important. And if you remember, I talked about the journal.
Yeah.
In the journal, I also ask my patients to write 3 things that they are grateful for.
I,
Yes, because that will help them see the beauty in their life. We all have things that we don't like, and we also have things that we like. So
yeah.
we should be appreciative because our brain is, it has this tendency to take the negatives
Yeah.
before the positives. So if we reinforce the positive things, the brain will change into a more positive approach. Our approach will be more positive when we look at our symptoms. And then I teach my patients about breathing techniques. The square breathing technique is
Yeah.
so simple to be done, and I teach them how to do it. And if you are consistent with this approach,
Yeah.
I can guarantee you will be in a better place in 6 months, not tomorrow,
Yeah.
because that's the other thing. I
Yeah.
don't want people to believe that things will happen overnight. But if it's not tomorrow, if it's going to be in 2 weeks or 4 weeks or 6 months, you have to have a long-term plan, and that will be your long-term plan.
Yeah.
I don't know if I told you about this, but I wrote a book about rheumatoid arthritis. This is also an autoimmune disease. I'll show you the book, if you allow me to show it to you.
Yes, of course. Please do.
I mean, it's not Sjogren, it's rheumatoid arthritis,
Yes.
but it talks about everything that I taught you today. I
Okay.
teach the same type of techniques to my patients with Sjogren because they are very similar.
Mm,
There are tweaks for Sjogren, of course,
mm.
but the base of nutrition and mindfulness and exercise, I try to capture it in this book.
Yeah, I did notice that you had written a book, and I gotta get it because, like you say, there are similarities, and there's a lot of inflammation, for example, when your body is inflamed. And so I think arthritis and Sjogren's both have a lot of inflammation, right? Which would be one thing, an
Correct,
anti-inflammatory
correct.
diet. And for us, and also the emotions, because then we get the cortisol, and then again, it's inflammation again. So I can understand why you would say that the link.
Rheumatoid arthritis and Sjogren, they come together a lot of the times. As I told you, Sjogren, secondary Sjogren is part of rheumatoid arthritis. And patients with Sjogren, they have many times symptoms that are very similar to rheumatoid arthritis.
Yeah.
So there is a huge overlap. And that's why I mentioned the book, because I always think about this overlap between patients with RA, rheumatoid arthritis, and patients with Sjogren. They're very similar in many, many aspects.
It's really interesting to hear you say that because I feel that for me, I have such pain right now. I get stiff. And a lot of times I think this feels like what I would think arthritis would feel like. So,
Patients with Sjogren, they have positive rheumatoid factor
oh,
many times.
yeah,
They have this elevated level of inflammation, which will affect the joints.
yeah.
And I have seen patients in the past misdiagnosed with rheumatoid arthritis. And in fact, they actually had Sjogren and not rheumatoid arthritis.
Oh,
Or
okay.
they had both.
Yes,
Yeah.
yes. There's a lot to think about there. There's a lot to think about. But I'm just so really honored that you were able to come onto this channel and talk to me and my audience. And I know we're all good. Well, I really appreciate it, and I know everybody else would really appreciate it. I know. If anybody did want to reach out to you and actually work with you, how would they be able to do that?
My website is called rheumatologistoncall.com.
So I will put all your details below so they can contact you through your website.
They can contact me through my website, rheumatologistoncall.com. They can call my clinic. The website has the number of the clinic. Booking an appointment or emailing us through the website, it's very, very easy to be done.
Yeah.
And they can also watch the videos that I produce for Sjogren. I have a YouTube channel where there is a whole list of videos for Sjogren, where I talk about the foods, the best foods, the worst foods. I talk about the supplements. I talk about the signs, the symptoms, the treatments.
Yeah.
And this week, I'm going to publish another video about Sjogren, and it's about one of the most well-known athletes in the world. You probably know her, Venus
Yeah.
Williams, that
Oh, that'd be
suffered
very
with
interesting.
Sjogren. And I share her story. I think that's very, very empowering for people to see what can you achieve
Yeah.
with Sjogren. And I also share more information about what Sjogren is and about the new treatments, the new clinical trials. I included there a lot of information. So I encourage people to watch it because they're going to find out new things that I'm learning as I
Oh,
practice
wonderful.
in this field.
You are the only rheumatologist. You are the one that I watch because I find your information so clear and so interesting and informative and helpful. And I really enjoyed the videos you do as well, where there are certain, I'm not going to name them, but actually you do on your videos, but there are certain practitioners and things who will say, like, I can't remember which one, but they'll say, this is good for you, this is bad for you. And you say, yes, some of this is good, but then do think about the other points as well, because there are some people on YouTube who will just say, this is good, and just go with this. And I love that you
Yeah,
break it down and you see both the science and the
absolutely.
validity.
I have seen a lot of people that they came to me, they were fooled by what I call guru in
Yeah,
autoimmunity.
yeah,
They have been through protocols and I don't know how many bottles of supplements, and they wasted thousands and thousands and thousands of dollars because, on one way, I understand people wants to get better,
yeah,
but I don't understand how some people that they do not have the qualification, they never diagnosed and they never treated a patient with Sjogren in their life.
yeah,
They have the gut, I would say,
yeah.
to give advice. But I do understand that they are selling something, they're
They're always
interested.
selling something.
Yeah,
They're
they
always
they
selling
want to sell
supplements.
something.
Yeah,
And again, I say to my patients, I understand you want to get better, and I will use all the tools
yeah,
and all my knowledge to get you better,
yeah.
but I never make promises that I cannot keep.
No, you never
And
know.
that's how that's what people will experience. People will experience this kind of greedy relationships where they go in and they are sold a million bottles of things and they are told to do whatever cleanses and they do it, and some of it may help
Yeah,
temporarily,
yeah,
but they don't cure the disease. So I
no,
want people to understand that there is no cure for Sjogren,
yeah,
but there is a lot of things that we do and people feel better. And
absolutely.
I can give you examples of patients of mine that they came to me in such a terrible situation and they are functional today and they came back to their life and they enjoy their life
Yeah,
because we do the best that we can for them,
yeah.
but we don't promise what it cannot be promised.
Thank you so much. Oh, thank you
And
so
thank you for
much.
watching my channel and sharing my
Oh,
channel with other
I so
people.
appreciate you. I
I
really appreciate you and your channel and yeah, everything. I'm a big fan. So I really
thank
appreciate
you so
you.
much and I wish you all the best and
Thank you.
all the best for you as well.
Thank you so
And
much.
for
Thank
your
you.
audience, of course.
Yes, no. So I will definitely put all your links below, and if anybody wants to speak with Dr. Grinita, everything will be in the description below. Thank you.
Bye bye.
Bye. Bye.
Bye.